India has recorded 8,171 new cases in the last 24 hours, taking India's overall tally to more than 198,700. 204 new deaths were also recorded, with India's COVID-19 death toll currently near 5,600. On your screens is the bar graph showing the daily surge in the number of cases. The last few days have seen an exponential rise in COVID-19 cases. Maharashtra, Delhi and Tamil Nadu are the worst hit regions in the country. The state of Maharashtra has recorded more than 70,000 cases. The national capital of Delhi also recorded more than 20,000 cases. In Tamil Nadu, there are more than 23,000 cases. Now, the three regions collectively recorded more than 100 COVID-19 cases, which is around 57% of the total cases in the country. India has seen a sharp spike in COVID-19 cases in the last few days, with cases nearing the 2 lakh mark. Over 8,000 cases have been recorded for the third straight day, and deaths are steadily increasing, with the current figure at around 5,598. Times are desperate. Hence, India has approved the emergency use of Gilead's antiviral drug remdesivir to treat severe coronavirus cases. However, the regulator, the Central Drug Standard Control Organization, has laid out a condition for the same. Only a 5-dose administration of the drug will be done and not more, no matter what. Now, today, the Health Ministry of India, in its briefing, said that the recovery rate in India is steadily increasing. It is currently at 48.02%, up from 11.42% on the 15th of April. India's COVID-19 fatality rate at 2.82%, too, is amongst the lowest in the world, whereas the global fatality rate remains at over 6%.
कि देश का रिकवरी रेट कंटिन्यूसली इंप्रूव कर रहा है। कल की तारीख में भी देखें तो 3,708 पीपल दे हैव गॉट रिकवर्ड, और उसके साथ ही देखें कि टोटल हमारा रिकवरी नंबर जो है वो बढ़कर 95,527 पेशेंट्स हो चुका है, और इस रिकवरी रेट में स्टडी इंप्रूवमेंट हो रहा है। जैसे कि इस ग्राफ में हम आपको दिखा रहे हैं कि 15 अप्रैल में अगर देश का रिकवरी रेट करीब 11.42% था, 3 मई तक बढ़कर वह 26.59% हुआ। 18 मई को वही बढ़कर 38.29% और आज बढ़ते बढ़ते वह बढ़कर 48.07% हो चुका है।
When asked about the community transmission, the Indian Council of Medical Research today said that India is far from the COVID-19 peak. Reiterating the effectiveness of the Indian government measures, the ICMR said that India has been very good in the reduction in mortality.
In terms of the number of deaths getting reported in the country, also even in different mortuaries, etc., there is no abnormal increase in number. It has rather even gone down.
Now, we are being joined by our principal diplomatic correspondent, Siddhant Sibal, for more on this story. Good evening to you, Siddhant. India is seeing a sharp spike in COVID-19 cases over the last few days, nearing 2 lakh cases. This, as lockdown restrictions have been eased, what is the latest that you have for us?
Well, Alison, situation remains grim here on the ground here in India. The number of cases are going to cross 2 lakh tomorrow, and number of active cases as well will cross 1 lakh. But there are positive silver linings as well. We know, as the Secretary said, that the recovery rate is around 48% here in India. And also he talked about the measures taken by the Indian government. In fact, he said that India is in safe hands. This is something that is reassuring. But if you look at the measures taken by the Indian government, the number of measures include boosting up infrastructure, health infrastructure. That is something that is the top priority of the Indian government, trying to procure PPEs, ventilators from across the world. In fact, India is all set to get the donated ventilators from United States very soon. We know that US President Donald Trump had tweeted that he's going to donate India 200 ventilators. But India's focus is to use this crisis as an opportunity. We know that India is trying to make more and more PPEs here in India, make in India PPEs. And also, if we talk about the measures, including awareness campaigns by the Indian government. In fact, today at the briefing which took place just 2 hours ago, there was an awareness video which was played by the Indian government, which included a Bollywood actor talking about the awareness which is required, especially when it comes to wearing of masks. And this is something that the Indian government has been talking about since day one. In fact, when the first day the lockdown was announced, but even as we speak, we know Unlock 1 has started, and very soon after 8th of June, we know the malls will be opening, the other public places will be opening, and this has been divided into 3 phases: phase 1, phase 2 and phase 3, in which the last phase in which metros and airlines are expected to start. So gradually India is moving towards unlocking of the country, but of course there are worries which is the number of increase in number of cases here in India regarding the COVID crisis, which is one of the biggest crises the world is facing as of now.
Right, in Sudan, India has finally approved the use of the antiviral drug, the remdesivir drug, for severe cases. What took India so long, and were we perhaps being overly cautious earlier?
Well, yes, India has finally announced that it will be using the drug, but only for emergency cases. And the secretary in the briefing which took place just 2 hours ago talked about only under specific cases. And of course, there are evidences that it is working. We know that India has got requests for remdesivir as well. In fact, WION got to interview the Indian envoy to Mongolia, who said that Mongolian government has requested 2 Indian companies to supply them with the drug. And this crisis has in a sense told to the world that India is the pharmacy of the world, and India has provided the medicines like HCQ and paracetamol to approximately more than 100 countries across the world. So expect India getting requests regarding that as well. But by and large, India is trying to make sure that before it helps the world, it is going to help itself. And this is something that India is going to focus on, that before any requests come, it will make sure that there are plenty of provisions here in India regarding it. So now India is banking upon both HCQ and remdesivir as a measure, as a medicine regarding the COVID crisis. Of course, we know that the World Health Organization has said that when it comes to HCQ, it has halted the entire operation waiting for certain tests. But India has said that it will continue with HCQ because it believes that it's going to help its frontline workers, and only frontline workers under certain conditions are allowed to use HCQ.
Sudan, thank you very much for that report. That's our principal diplomatic correspondent, Sudan Sabal, bringing us the latest on COVID-19 in the country.